if you have PCOS and you're trying to conceive, come join me, grab your tea and come join me as we're going to talk about trying to get pregnant and PCOS today, and 2 things that are really important for you to watch out for. I'm Denise Noyer-Erez, and I am your fertility godmother, and I help women save time and pain on their path to pregnancy. And I work with women in groups, one-on-one, and with my online programs. So today we're going to be talking about PCOS, because PCOS month is coming and it's something that a lot of women are dealing with. And so if you're here, then let's talk about that now. I'm getting some messages. Hold on a second. It's distracting me. I want to be able to focus on you. Okay, let me try not to see that. Okay, so the first thing about PCOS is you need to know that everybody has a different stage of PCOS. Some people have it light, some people have it pretty strong, they have a lot of symptoms, right? So depending on where you are in that scale, it's a pretty wide, diagnosis scale, and it's pretty wide. So different things will definitely work for different people depending on what's going on. But the first thing that you need to be able to do if you have PCOS is regulate your menstrual cycle. Making sure that you're ovulating and that you're having a regular menstrual cycle will help you get pregnant. It makes sense, right? Because I know that's one of the things you're struggling with most is, when are you ovulating? If you're ovulating, those ovulation predictor kits, they don't really work for you. Sometimes they're going to be telling you you're ovulating and you're not ovulating. So that might not be the best method for you, and it can be really, really frustrating. So if that's happening for you, if you're finding yourself being really frustrated, those ovulation predictor kits probably aren't working for you, and you don't need to spend the money or get the anxiety of going through that. A basal body temperature chart can be helpful, so you can start to track certain patterns. The more regular that your menstrual cycle is, then you're probably ovulating usually around 14 days before you have your period. So that's probably about when you're ovulating. Now, there are natural ways to help you regulate your menstrual cycle. And one thing I want you to realize is that if you have PCOS, then you have a good chance of getting pregnant. You just got to get your body back in balance, and it's absolutely doable and possible to do. So I want to make sure that you really get that, because I've been seeing around, and Haley has been sharing with me as well, as we're always trying to look at what's going on. There's a lot of misleading information and scary information out there. So you don't have to do IVF if you have PCOS. Now, maybe it's absolutely an option for you, but it's not necessarily a have to do. Okay, so that's something that I want you to know. The thing is, if you're trying to get pregnant with PCOS naturally, it depends on how severe it is. So if you're having menstrual cycles, you have PCOS, and you're having menstrual cycles, every 30, 35 days, then that's a little bit easier than somebody who hasn't had a menstrual cycle in over a year, right? So you have to kind of factor that in as for the time frame of you wanting to get pregnant. It's really important that you're healthy and everything is healthy for at least 3 months before you try to conceive. So when you're trying to get pregnant, once your periods start to become regular, you want to wait at that point at least 3 months, if you can, before you can conceive. So I was speaking with a woman last week who has PCOS, and she is working on her eating habits, but her blood sugars were really, really high. So we want to make sure that your blood sugars are going to be normal for at least that 3-month period. So it's going to take time to get them down, and then it's going to take time to regulate everything. And then it has to be regulated over that, at least that period of time. It's so important. So blood sugars is the other thing that's in insulin levels, that's key to having when you have PCOS, to make sure that you are monitoring that. And you can do that a lot through diet. And one supplement that seems to be really great for PCOS, and that I like to recommend the people I work with, and that is the myo-inositol and the D-chiro-inositol, and having that 40-to-1 ratio. You do need both of them, not just the myo-inositol and not just the D-chiro. You need both, and you need it in that 40-to-1 ratio. And it seems to be, hi Allie, thanks for joining. We're talking about PCOS today. It seems to be really important for to help balance and regulate your insulin levels. Some people get put on glucophage or metformin, right, which is a form to help with insulin. It can be helpful. It's an option. Some people don't do well with it at all, but the myo-inositol D-chiro is something that helps balance that out. So it can be an alternative to, or maybe even in conjunction with, if you're taking that medication. I have some women who have PCOS who like to be on the supplement, and they don't need as much of the metformin. So it's kind of playing around and finding what's going to work best for you, right? But making sure your insulin levels are normal, and making sure your periods are regular. Those are going to be the two key things you can do. So the thing that you can do on your own to help this is diet. And you may be tired of hearing it, but the foods you eat are so important. Hi Navita, we're talking about PCOS today. Welcome. The things what's so important for you is so important to balance your eating habits and eating nutritionally. And there's two things that are really inflammatory for everybody, but can really impact women with PCOS, and that is dairy and gluten. So you may have heard about this before, and I'm not necessarily, depending again on how severe your case is, right? Because again, it's a pretty big range. So depending on how severe your case is, you may be able to have a little bit. But the studies show that if you decrease dairy, you decrease and eliminate gluten, and you exercise, hi Haley, welcome, then you can regulate your menstrual cycle and really help your fertility. So just doing those three things are going to be so helpful and beneficial for you. And you can also, sorry, I got distracted there. I'm getting text right now. So, and you can also, where was I? I was talking about supplements, exercise, and diet. Those three things, they're going to be so important for you in helping your fertility. And I've had women who I've worked with who ended up gaining a lot of weight through PCOS. And then, so yes, it is ideal if you can lose some weight. Now, if you can lose 5 pounds or 10 pounds, depending on where you are, that makes a huge difference. And you can see this shift in your cycle just by losing weight. So that's something that can be really important. I read that diet and making sure exercise really helps with PCOS. Yes, so that's exactly what I just mentioned about diet and exercise is huge. And so this is the thing. This is how I like to look at things. Maybe because I believe in overall wellness, and your wellness impacts your fertility, and your fertility is a sign of your reproductive wellness. So for me, exercising and diet, or everything you put in your mouth, is just part of our overall wellness and lifestyle and longevity, right? Staying young, staying vital, staying fit. So yes, if you can absolutely manage your PCOS, and it's so important through diet and through exercise, and just making it part of your overall lifestyle is so important. So the main point I want you to get today, I guess, would be just know that you can get pregnant with PCOS. You can have a healthy baby. The key is being healthy first, and being healthy for at least 3 months before you conceive, and then of course during your pregnancy. And you have to manage your insulin levels, and in order to get pregnant naturally, you need to regulate your menstrual cycle. And you can do that through diet. You can do that through the help of some supplements, and you can also, acupuncture works really, really well as well. And I like to use herbs. So there's a bunch of different herbs out there. Just really, if you're going to be using herbs, work with someone like either me, I'd love to help you, or someone like myself who can guide you, because herbs are a little bit tricky. You think that they're natural and they're not going to have any side effects, but that's not always the case. You have to be careful with your herbs as well. So those are the ways that I help regulate menstrual cycle. And you guys, you have to have some patience and be kind to yourself and know that it's going to take some time. So it takes time to regulate your menstrual cycle. It takes time to get healthy. So you want to go ahead and, if you haven't already started, start now. And if you've started, amazing. Keep moving forward and start looking for changes. Start looking to see some different results in your overall health, in your energy, in your menstrual cycles, and in your in your weight. Yes, I think that's everything. Okay, so I hope that this was helpful for you with PCOS. We are dedicating this whole month of September in honor of you, so watch out for more ways that can help your health and help your fertility over this next month. And until next time, I'll see you. Take care and make it a great day.